What's going on, guys? Dr. Greg here with Movement Driven. Today we're going to go over a simple exercise to get a muscle called your multifidi active and awake. The multifidi are little muscles that span up and down the spine, but they're most prevalent in the lumbar spine of the low back. And they're very adjacent, very deep, and right against that spine. And they're kind of the main stabilizers on the back side. So when we have low back pain, what happens is within 24 hours of having pain in the low back, these muscles not only shut down according to functional MRI, they actually begin to atrophy in 24 hours. And so one of my philosophies is that people with recurrent chronic low back pain have pain and never get taught how to turn these back on. And then we're constantly over-recruiting some of the paraspinals up top or the QL muscle to the side. And when you're doing deadlifts, you're doing anything that's requiring you for some low back strength, you're not recruiting the right muscles, and it's leading to more compression in the spine, and hence recurring low back pain, re-aggravating disc issues and joint issues in the low back. So what you're gonna do is simply get little weights. I got 2 pounds here. I don't want you going much heavier than that at all, especially at the beginning and especially if you're in pain. And what you're gonna do is you're gonna get into what we call a little hinge position, so a little modified deadlift position. My pelvis is in neutral. I'm hinging my hips backwards and letting my chest kind of fall, but I don't wanna collapse the spine and bend it. So hips back, nice contracted core, like somebody's gonna punch me in the gut. And then I wanna reach out and I'm simply going to drop one at a time to the knee. This is a slow endurance type exercise. I wanna feel a good muscle burn right along the spine, right above the belt. I don't wanna feel it go up or out because that means I'm starting to compensate and engage muscles that have been working overtime for years or at least weeks or months if you're new to low back pain. So again, hinge back, core tight, reach out, and we're tapping one at a time. The goal is to get to 15 or 20 in each arm. But again, if you start to feel the pain or the soreness or the muscle fatigue elsewhere, take your break, relax, do another set. Let me know how it goes.